Hello 571 class. I'm here today again to show you something different, how to use the Oto Opthalmoscope, and in more particular the way we had set it up for this semester with the new policy if you did not have the equipment. So I just want to go through a quick review of the equipment itself. This is the handle, and it's for the otoscope and the ophthalmoscope. It's universal with the universal fitting on top. Now you'll notice a ring around the top that's black, and then you have this green button. You push the button down and you rotate it, and that turns it on, one. Number two, it controls the intensity of the light. While you're turning it, that green button is depressed. Now when I turn it back, you're going to hear a click and that button will pop up. That means it's off. It's very important for when you're done using the instrument because if you leave it on, the batteries will wear down. You'll go to use it and it won't work. So that's why it's important to shut it off every time that you use it. When we're talking about the otoscope for the ear, this is the macro view head, and the special features about this for Welsh Allen is for the tip, it's a quick release on the top, and there is special ear tips that go on it. So the gray ones will not work on this model. Okay, you have to have the black tips, and it has 3 different fins that are on the end of it. Okay, those fins will fit in, and you just turn it a little bit. You don't have to wrench it on. It's not going to make it any better. And when you do that, it stays. It will not come off. To release it, all you do is turn that ring, and it'll fall right off for you. So that's the otoscope piece. Now if you're doing your physical exam, when you get to the ears and you don't have any equipment, you have to explain what you're doing. Okay, so you're gonna inspect the ear, the outer ear, the pinna. You're gonna tug on it to see if there's any pain. Now you can explain how you would go about using the otoscope. Okay, for an adult, you would grab the pinna and you're going to pull down, out, and up. Okay, and what that does, it straightens the canal. Okay, now you can insert your otoscope, and the way you insert it is handle up or the handle coming out towards the mouth of the patient. Okay, because that gives you more control and it allows you to see the structures better. If I had the handle in the back, you're going to be limited to your movement and to what you're seeing. So once I go in, I'm going to angle the otoscope up just a little bit, and then what I should see is something in the back that's pearly gray, and that would be the TM or the eardrum. And that pearly gray part is usually around 4 o'clock, 5 o'clock, or somewhere in between. Okay, that's the reflection of light from that membrane, that TM, that eardrum. And then you would comment, of course, if there's any abnormalities with the canal. How does the canal look? Is there any debris there? Is it red? Is it pink? Is it moist? Is there fluid there? How does that TM look? Is it angry, red, bulging, retracted? Those are the terms we use to document and describe what we're seeing. And that would be it for the otoscopic exam. Now when we get to the ophthalmic exam, let's kind of review that. We already know about the handle. Okay, now this is the ophthalmic head. It fits on the same way. Okay, the heads will fit into the grooves. You push down just a little bit and you turn, and it'll lock it into place. Now the things you really have to be concerned about is the aperture, which is in the front. Okay, and you know that you want the largest aperture because it allows the largest amount of light, so you can see more area in the eye, in the structures that you need to. The other thing is this thing on the side is called a diopter, which is really a focus ring. And on the provider side, you'll see a little round button there. That's going to illuminate when it's on. Okay, and there'll be some numbers in there, and that coincides with the diopter, the focus ring. So what you do first of all is you turn on the unit, okay, and then you make sure that you have the diopter that's the biggest amount of light. That's what I'm going to use. And then you want to focus something that's about 10 feet away, or I mean 10 inches away. Sorry, 10 feet would be huge. So 10 inches away, and you just want to focus. Okay, and that'll be enough to get you started. Now when you're doing the exam, you want to be that same distance, okay, that 10 inches away. And what you're going to look for first is the red light reflex, right? And then you're going to, once you have that, you should be able to go in to about maybe an inch away from the patient. And then you can see the rest of the structures. Now, if you do not have one of these ophthalmoscopes, you have to describe it for me on your CPE. So once you come to the eye exam, you're going to do all the other things. You're going to look at the structures of the eye that you can see without the instrument. So when it comes time to do that ophthalmic exam, I want you to tell me that the first thing you're going to do is ready the equipment. Okay, you're going to turn on the ophthalmoscope, and you're going to use the aperture control to get the largest amount of light, so the biggest ring that you can find. You're going to have full intensity on the ophthalmoscope. Then you're going to focus 10 inches away, and now you're ready to take a look at the patient. Now when you take a look at the patient, remember it's a right eye to right eye, left eye to left eye. Okay, otherwise you'll be kissing the patient, which may be good, but it may be bad. Okay, in most instances you don't want to do that. So then what I would do is I would hold the patient's eyebrow and just tug up. Okay, you're going to have the patient look right over your shoulder and just tell them to keep looking no matter what you're doing. I'm going to shine a bright light in your eyes, but I just want you to focus on something on the back wall. Okay, so now that you're ready to go in, 10 inches away, you're going to look for that red light reflex. Okay, once you've found that, you can now go towards the patient, ending up probably about an inch away. What you'll find is these black things that come across the lens that you're looking at. Those are the vessels. Okay, what you want to ideally do is follow those vessels, and you're going to follow them medially towards the nose. Why do you do that? Because we know that all those vessels converge in that area. And what you're going to find is the disc and the cup, both medially. Okay, one inside the other. Okay, the disc is on the inner side and the cup is around the outside. And you'll see the delineation of both. Once you've found that, now you can move laterally just a little bit. And what you'll find is an orangish, reddish ring with another ring inside of it. Once you've found that, that's the macula and the fovea. That is dead center right in the middle of the eye. Okay, so you're seeing central vision. So people with central vision complaints, that's the area that we're talking about. Okay, so all the nerves and everything innervate in that area. Okay, so that's the importance of that. So those are the things that I would be looking for in the ophthalmic fundoscopic exam. I hope this was helpful in completing your CPE. If you do this just the way I explained it, you will have no problems. Thank you.